changed significantly since the last 1 month in India as to what the current scenario we are facing and what implications will it have on our pediatric practice. I'm going to talk about that. I won't go into the very intricate details about the current pandemic scenario we are in, because all of us are regularly going through newspapers, print media, as well as social media, as well as media, as per the updates of the current crisis. But I would just like to reiterate a few points as to the things we should be doing, we should be practicing, not only as of now, but also for the future, because this scenario is going to last for a long time. So pediatric practice, as we all accept, has been traditionally a very safe practice, because the child does not usually transmit his infection to the healthcare provider, because we are all immune to whatever illness the child has, majority of us, if we are not immunosuppressed. Transmission mostly happens within the pediatric age group, and most commonly what we see in the pediatric age group are infections, mostly respiratory and gastrointestinal complaints being the most common. And vaccination, as we all accept, has been the age-old method of providing passive immunity. So this is the perspective of the pediatric practice which has happened so far in our country for all of us. Now, let us come to the current scenario. Because of the COVID-19 outbreak, which has been declared as a pandemic by the WHO in March 2019, the scenario has changed significantly, not only regarding the patient's overall condition, but the condition of the overall medical facility, the medical team, as well as the hospitals catering to these infections have changed significantly. In this regard, our practices are also going to undergo a sea change. This virus, I'll just mention a line about this virus, also known as the severe acute respiratory syndrome COV-2 virus, which is an encapsulated RNA virus with spikes. It has got a very high level of virulence. And because it is a novel virus, it has come new. It was previously existing in bats as per the literature and has now come to us in humans. We are facing the brunt of it because we do not have any innate or any immunity to this sort of virus, and that's why we are suffering. But the good thing is that our patient, that is the pediatric age group, is not growing or is not facing the brunt of this situation, because the virulence somehow has been shown to be less in this pediatric age group. As has been shown in many studies right from China to the Europe and now in the USA, it has been said that less than 2% of the population is belonging to the pediatric age group, that is less than 18 years of age, which is quite significant. But the main problem which we are going to face in the coming days and the coming months is that the asymptomatic carriage rate in pediatrics is very high. And there is a very high level of transmission to the healthcare provider. So for example, if a child comes to us and the child is infected, he may not show any signs and symptoms, but we may get infected from this disease. And because we are the healthcare providers and we are adults, we are bound to get infected, and maybe the disease process will take a harsher course in us. And for majority of us, the pediatricians, this is also a novel scenario, because never have we been so concerned about getting infected from the patients. Now, I'll just go through a few symptoms and signs, and why is this so difficult times for us, is that these children, unlike adults, majority of them may not come to you with fever. Fever is usually present in around 40 to 70% of the cases, with some presenting with cough, coryza, sore throat. Respiratory distress may occur even after 8 to 9 days. So once you're suspecting that someone is infected, it may not happen that he or she is developing respiratory distress, because that may come after 8 to 9 days of illness. It resembles an influenza-like illness, and diarrhea may happen at times. So fever or only diarrhea could be a presenting symptom. In older children, however, some children may complain of a loss of taste or loss of smell. Mostly those more than 8 years can complain of this sensation. Myalgia, headache, like any other viral or any other influenza-like illness can happen. Poor feeding, especially in the smaller children. Lethargy. And we should also ask the history, which is very important nowadays. Any history of travel or any history of contact should be significantly should be there in the present scenario, or now with gradual community transmission happening, this history may also be absent. Now, what are the problems we are facing? This is a novel disease which has come up over the last 3 to 4 months. And because of this being a new disease, there are hardly isolated case reports or small studies which are catering to this disease. And there are no well-conducted RCTs, which would give us more of an idea of the disease and the pathology and the pathogenesis. So we are gradually learning, and all of us are learning together. It's not that someone has got more knowledge, someone is an expert on this. Even the world over experts, who are the virologists, the other pediatricians world over, or the medical people, they are also unsure. Guidelines are just being made, and majority are coming from affected countries. Based on whatever experience they are having, they are making guidelines. But we should also remember that there is a demographic difference in between populations. So whatever is applicable to the Chinese population or the American or the European population may not be applicable for us. So there's a huge demographic difference. And so we should all keep our fingers crossed and just hope that the disease does not affect children that severely. Majority of the studies are adult studies and extrapolated in children. So again, we have to be very careful in children. The problem of asymptomatic carriage, as I mentioned, is very common in children, as has been shown in majority of the few studies which have been published, that children are asymptomatic carriers. And because the children are carriers, they may transmit the infection not only to the healthcare provider, but also to their family members, other members they are getting in touch with. So any children with influenza-like illness should be thought, especially in somewhere where this scenario is very predominant, as he's carrying the disease, and should be treated in that manner. Parent or family members can carry the infection when the children are coming to us in an infection scenario. Children are not well adept at following hand hygiene guidelines, especially the younger ones. Use of mask or social distancing may not be feasible, especially for small children. However, how many times you may tell them, they may not follow those small things because they do not understand. Cough, sneeze etiquette, which should be ideally followed, is not uniquely followed in younger children. And variety of symptoms at presentation, as I already discussed. And aerosol generation is very high, especially in children. We shall come to that later. Now, the current Indian scenario. There has been a gradual increase in the number of cases and deaths from this disease over the last few days, as we are seeing, and weeks. Lockdown strategy has been implemented, which makes us in a completely new world altogether, because we've never been through this scenario. And majority of the clinics, our OPDs, have been closed. Hospital OPDs are running quite meagerly. Triage facilities are working suboptimally, and low level of education and understanding in our population is further increasing the problem. So what do we do? So we have to approach this problem in a manner which the IIP has helped us to do. The IIP infectious disease chapter has given us a 3-pronged approach, and I think that would be the best approach to go in such a scenario regarding our practice. First is protection of the healthcare provider. That is very important. Protection of the patient and protection of the workforce. That means those who are associated with healthcare. Let's come to those one by one. First is protection of the healthcare provider, or self-protection. Now, if we don't protect ourselves, and if we fall sick or we go into quarantine, who will treat the patients? So it's very important, and of utmost importance is our own protection. And we should be using standard and droplet transmission precautions, using of a standard, either a 3-layer surgical mask or an N95 mask, depending on what patients we are catering to, using of a PPE if you are sitting in a respiratory OPD and you're seeing a large number of respiratory patients, with suspect patients being high, because children will be asymptomatic carriers. And the type of hygiene you are going to maintain in front of children will be, children will maintain definitely less hygiene, smaller children. Perform hand hygiene. Always remember the age-old habits of hand hygiene, touching before before touching a patient, after touching a patient, after touching any surface, before doing a procedure, after doing a procedure is also of paramount importance. And we should also remember that this virus has an envelope, has a lipid envelope, which gets dissolved by soap. So regular hand washing with soap and water, any soap for that matter, or any alcohol scrub for that matter, which contains more than 60% alcohol, is good enough to kill the virus. Refrain from aerosol generating procedures. Now, these aerosol generating procedures, as we all know, in pediatrics is quite a lot. We should not be collecting samples or suction patients without proper PPE, because this is the aerosol mode, which increases the transmission of the virus. Normally, the virus is, as we all know, gets transmitted in the form of droplets or through fomites, but aerosols, when it becomes aerosolized, then it can travel farther and can stay in the suspended in air for quite a longer period of time, and hence aerosol generating procedures should significantly be decreased. We should preferably avoid oral and pharyngeal examination, because this is another thing which generates aerosols. It generates cough. The patient will directly cough onto you, and this has to be decreased. So until and unless significantly it's required, oral or pharyngeal examination should not be done, or even if it is done, it should be done with the help of proper PPE or proper N95 mask. Avoid examining a crying child. Any crying child will throw out aerosols. So avoid examining a crying child. Be careful while examining the child. Preferentially avoid or try to examine the child from distance. Do not give nebulizations in your clinic. Another thing which is being propaganded is trying to shift to MDIs with a spacer and mask, even at home, rather than giving aerosolized medicines. So these nebulizations should be decreased and shifted to MDI with spacer or mask, even as what is required. Now, protection of the patient. This is another thing which is of paramount importance, and how we should be doing this is also very important. We should give appointment to a patient over phone, one at a particular time. That means when someone is asked to come at a particular time, they should maintain the time. If you ask someone to come at 5 o'clock, it should not be that the patient should be coming at 5:30 or 6. Give the patient 10 to 15 minutes time, examine the patient, maintaining proper hygiene, and try to maintain and try to clean your stethos and clean your tables and clean your equipments before and after seeing the patient, as I already mentioned. Decrease your overall patient load to ensure safety. Because if you don't decrease the patient load, it will happen that the patient will come to you, significant numbers of patients, when they come to you, your hygiene will definitely get hampered. And hence you have to ensure patient safety and decrease your overall patient load for the safety of your patient, for your safety, as well as for the safety of your healthcare workers. Refrain from attending patients with respiratory symptoms if you do not have proper facilities. So proper facilities, that is masks, gowns, PPEs, should be present if you're examining respiratory patients, because in this scenario, we do not know which patient is a COVID patient, which patient is other influenza patients. A history of travel or contact should be incorporated into the history, because that is of paramount importance. Whenever you're asking the patients to come and sit in your clinic in the waiting area, they should sit with proper distancing, and it should not be a crowded space. Proper distancing should be maintained, and ensure proper hand hygiene to all patients, as I previously mentioned. Encourage wearing of masks, or which may be a 3-layered mask, and provide one if they do not have one. If someone has come to you without a mask, provide him one from your clinic, and ensure proper hand hygiene is there, so that the rate of transmission of the disease to your clinic and hence to other patients will be less. Both the child and parent should wear one. It's not only the child, but also the parent should be wearing one, and only one attendant per patient should be allowed to decrease the overall load of infection and the infectivity. Telephonic or video consultation, if feasible, should be done, because these modes of consultation once which were not allowed have now again started to be allowed by the government, and more of video consultation or telephonic consultation for children who are not that sick or mildly sick may be done. Once they are ill, sick, moderate to severely ill, they should be brought to your clinic or the hospital as the case may be. Special care of immunocompromised and children with underlying chronic disease is very important, because it has been shown that even though pediatric age group are not significantly affected, but babies, especially those who are infants less than 1 year of age, who are immunocompromised and with underlying lung disease, heart disease, or liver disease, or kidney disease, they have a high fatality rate. Protection of workforce. This is another thing which is very important and should be given a paramount importance, because they should have minimum exposure to the suspect patient, because they are the ones who are waiting outside your chamber, seeing exposed to the patient. So they should be exposed to the patient less. So they should be given, they should be told to maintain distancing, maintain hand hygiene, and maintain a proper registry, and have proper PPE and masks while taking down the history or taking the names and the addresses of the patient. Screening of patients and parents before entry into your clinic, it's must, because someone who is ill, a parent who is ill, and if you're around, allow that parent to come into your clinic, then everyone's protection is at stake, and that should be disallowed. Proper mask plus minus PPE for these healthcare providers should be given, as I mentioned, and encourage these employees to stay at home if they fall sick or any symptoms of fever, of any other influenza-like illness symptoms develop. Advice for infants. This is very important, because infants are one group who are vulnerable to this disease, and they may show signs of significant illness like elderly adults. So children less than 2 years of 2 years age do not or cannot keep the mask rather on their face. So maintaining the proper cough etiquettes or sneezing etiquettes is difficult in this age group, and you have to be very careful while seeing these children. Mothers should breastfeed their children, especially even if the mother has come out positive, they should breastfeed their children, and they should wear gloves and masks and follow good hygiene while feeding their child, because it has been shown that breast milk confers passive immunity to the children, and hence should be continued. Infants, if the infants are symptomatic, we should get them tested, as they may have signs of severe infection and they may worsen dramatically over a short period of time. So that should be done. General advice for all patients should be telephonic appointment for all patients, as I previously mentioned, should be given, and no one should be allowed to come without a consultation and crowd in your clinic. Designate the morning hours for well patients, as has been beautifully advised by the IAP group, that designate morning hours for well patient visits, including vaccinations and non-respiratory patients, if the case be. Prior to the vaccination, those vaccinations which are absolutely necessary should be given, especially the DPD vaccines, the MMRs, the influenza vaccines, the pneumonia vaccines should be preferentially given, rather than the non-essential vaccines such as the meningococcal vaccines or other vaccines for that matter. So those vaccines may be given later at a non-emergency time. Afternoon or evening hours for all respiratory patients should be advocated, because as we know in our pediatric practice, majority of our patients are respiratory patients, and these patients should be given adequate time. Again, slots should be made for patients, each patient having a 10 to 15 minute slot. Examine them well, clean your room properly prior and after examine each patient. Disinfected the chamber in between the morning and afternoon shifts, because this is very vital, so that all the patients so that they do not get cross-infected. Clean your stetho, clean the surfaces, your tables, your door handles in between patients, mostly in the afternoon shift, especially after the afternoon shift. Maintain social distancing in the waiting area as well, as I previously mentioned. General hand hygiene should be followed, and cough etiquette and social distancing to all patients who are older than 3 to 4 years, as well as parents, should be reiterated, because it is the doctor to whom they will listen. It may happen that they may not be listening, or they may not be listening to their parents, they may not be listening to the other members of the family. But if the doctor tells something, usually the patient listens and follows it diligently. So it should be reiterated. Uh, any form of payment, it's better not to accept cash, rather than electronic modes of payment may be accepted to decrease the chance of infection. Doffing of PPE, if you are wearing one, including mask in the designated area, hygienically should be disposed of. Use N95 mask reuse protocol. If, as we all know, there is a shortage of these special forms of masks, you can follow the AIMS guidelines for that matter, if be so. Preferentially avoid cell phones, watches, bells if you are sitting in your chamber, because these will act as fomites and carry your infection, spread your infection to other places as well as your home. Vividly clean items in your clinic before entering the home, and get a bath as soon as you reach home, and wash all clothes with soap and water, and iron them when dry. So coming at the fag end of this presentation, the take-home messages for this, for all our pediatric practice would be: in pandemics, there are no emergencies. Protect yourself first, be mean, protect yourself first, then treat your patient, because only when you are safe, your patient will be safe. Inculcate social distancing and hand hygiene in every patient or family you see, as I've mentioned, because only the doctor's words will be respected more than other people's words and what they are seeing on any form of media. And the last point is that this pandemic will change medical practice once and forever. So let us take the positives from this pandemic, and let the sense of hygiene prevail forever, because it will help in our future practice, and it will help in the safety of all our patients. Thank you. Yes, I'm seeing a couple of questions which have come in. Dr. Kiriti has asked: precautions to be taken while giving immunizations. The standard precautions which you are maintaining should be taken while giving vaccination. The hand hygiene, the uh, hand hygiene should be reiterated again and again. And as I said, the precautions, give those vaccines which are absolutely necessary. Otherwise, I don't think any other vaccines. And try to put in the mask on the face of the child when you are giving the vaccine, and keep yourself protected. That is one thing. Another question has come in from Dr. Olokananda. Shouldn't we start testing from OPD too? Because we cannot admit all suspect patients, and patients can be in home quarantine till reports come. Especially with, I think in this scenario, we should follow the government, we should follow the ICMR guidelines. And if the ICMR guidelines dictate us to get testing done, we should be, and if we are suspecting significantly, we should get the child tested, because it will save not only you, but the entire family and the entire community from getting infected. And definitely they have to be put, especially where you're suspecting, you have to keep the child in home quarantine.
those were the questions on WhatsApp.
Yeah, these two questions only.
Hello?
Yeah, these two questions only.
Yeah. Thank you so much, sir.
Yeah, thank you. Thank you everyone for your kind listening. Thank you. Thank you everyone for your kind listening. Thank you.
So we have stopped.